So what does a country do when literally millions of its citizens don't have a doctor? Well, Brazil found itself facing that exact crisis, and its answer was a really ambitious and pretty controversial program called Mais Médicos, which just means more doctors. Today, we're going to break down exactly how it works and what it teaches us about healthcare as a right, not a privilege.
All right, here's our game plan. First, we'll get a handle on just how bad Brazil's doctor shortage was. Then, we'll dive into the Mais Médicos program itself and how it was designed to fix things. We'll meet the special foreign doctors at the heart of the plan, walk through the intense gauntlet they had to survive just to get started, and finally, we'll look at the real-world impact of it all.
To really get why Brazil did something so dramatic, you first have to understand the sheer scale of the problem they were staring down. I mean, just stop and think about that for a second. What if your town, your community had no doctor? Not a single one. No one for a checkup, no one for when your kid gets sick, nothing. It's a scary thought, right? Well, for millions of people in Brazil, that wasn't a hypothetical. It was their daily reality. The country had this massive doctor shortage, and it was worst in the places you'd expect. Remote areas, communities that are super hard to get to, and especially in places with high social vulnerability. These were the communities that were just consistently left out. So in response to this crisis, the Brazilian government launched Mais Médicos. It was this huge, ambitious, and, as we're about to see, really structured program to get doctors right to the front lines where they were needed most. Mais Médicos, like I said, literally just means more doctors. And that was the goal, plain and simple. It's a public policy designed to put doctors directly into those underserved areas, and by doing that, strengthen the whole public health system in Brazil, which is known as the SUS. And what's really clever here is that it's a two-pronged attack. On one hand, you've got immediate relief, like an emergency response to get doctors into communities that have zero right now. But on the other hand, it was about playing the long game, investing in training and even building new medical schools in those same regions to create a sustainable local workforce for the future. The program's main focus is on primary care, your local family doctor. Why? Because, get this, an estimated 80% of all health problems can actually be solved at this level. If you can strengthen that front line, you stop bigger, more expensive problems from ever happening. It's a total game changer. Okay, but you might be wondering, where on earth did they find all these doctors who were willing to go work in these really remote places? And that question, that leads us to the most unique and fascinating part of this whole program, a special type of doctor called the intercambista. So an intercambista, or exchange doctor, is any doctor, they could be Brazilian or from another country, whose medical degree is from outside of Brazil. And this is the key detail, because it puts them into a special category with a whole unique set of rules made just for this program. And these rules created this really tightly controlled system. For starters, their work permit means they can only practice medicine in their assigned town as part of the program. That's it. They don't get a standard Brazilian medical license. They get a special temporary one from the Ministry of Health. They're given a 3-year visa that can be renewed, and here's a huge incentive. Their families can get visas and work too. They're even enrolled in Social Security. You see how every single rule is designed to keep these doctors focused on the mission in those specific communities. Now, you're probably thinking, okay, but can you just drop doctors from other countries into a remote Brazilian village and say, good luck? Not even close. Before they ever see a single patient, they have to survive what is honestly an onboarding gauntlet. Every single one of these exchange doctors has to go through a mandatory welcoming module. And we're not talking about a quick afternoon orientation. This is an intense, in-person course, a minimum of 160 hours of training. And this whole process is absolutely non-negotiable. It starts with that 160-hour module, where they learn all about the Brazilian health system and, critically, the Portuguese language. Next, they have to pass a test on both their language skills and their medical knowledge. Only if they pass that test do they finally get their special license, and only then can they report for duty. The stakes are just incredibly high. If you fail that evaluation, you're immediately dismissed from the program, gone, no second chances. So after all of that, the big strategy, the unique rules, the crazy intense training, what's the result? Why does this whole program matter so much? Well, this quote really gets to the heart of it. The goal was never just about putting bodies in clinics. The real aim was to find, and I quote, doctors who create bonds with their patients and with the community. The true goal here was to humanize healthcare. And when you look at the achievements, you can see that focus paid off. The program brought more equitable access to millions, and by really hammering home that doctor-community bond, it improved the quality of care, which led to super high satisfaction rates from the patients themselves. And maybe most importantly, it's laying the foundation for a permanent fix by creating new medical schools right where they are needed most. At the end of the day, Brazil's Mais Médicos program is one really powerful, really complex answer to a universal question. It's a fascinating model for how to tackle a crisis while still building for the future. And it leaves all of us to think about that big question. How can any country, anywhere, make sure healthcare is truly a right for everyone, and not just a privilege for people who happen to live in the right zip code? Thanks for joining us for this explainer.